So thanks a lot. So hello to all of you. Welcome to this debate on the great mutation shifts of our professions that I'm really glad to moderate here. And I thank again all and Guy to trust me. I'm glad. I'm just a little impressed because having spent a lot of time in the public, here I am in charge of moderating here. It's a great first for me. So with a panel here with which we're going to talk about this great shift, mutations of our professions. So the general theme of the CHAM is to rethink the healthcare professions. Here we're going to talk about the existing jobs, not the future jobs, so the existing ones. So hence the presence of our panel members here. We're going to ask ourselves what makes these jobs, these today's jobs, called to change, to be transformed. So we have to analyze them first, see the impact they have trade by trade, job by job, and among themselves. And we're going to ask ourselves the issue on how to accompany these shifts. Who says mutation says upheavals, and these upheavals have to be accompanied, namely in terms of human resources. So we're going to start with a quick question I'm going to ask all of you, and I'm expecting a quick answer from all of you. What are the most significant changes, the strongest, the most impactful that you can observe in your respective professions that you all represent in the field of the health field here? I'm going to start with pharmacist here, Carine WOLF-THAL. So I'm going to start the discussion here. So evidently, a lot of shifts, mutations for all of the trades for pharmacists, the industry, manufacturing, distribution, medical biology. So it's the whole supply chain of pharmacists that's evolving, that is shifting. Society evolves, as you know. The needs in terms of health are changing, and so pharmacists have to change, have to adjust to these evolutions. So we have hinted to many shifts in the industry, innovation, thanks to AI, namely, but not only. Distribution also, I heard Amazon, I heard hospitals. Distribution also in pharmaceuticals is adjusting to the challenges and stakes. And we'll look at the stakes of shortages of medications, hospitals, many evolutions on pharmacy, clinical pharmacy, innovative therapy that are targeted, that are set up by pharmacists in hospitals, surgery, medical surgery that is experiencing a lot of shifts with an increase on prevention and pharmacies. This is my job. I allow myself to mention that. Pharmacies have made a big turn around prevention, namely, which is a topic that is very important in public health. Prevention, the turn has been taken with vaccination a few years ago when the pharmacists were invested in vaccination to improve vaccine coverage in our country, the country of Pasteur, of course, which is very below the recommendations. So vaccination then, how we detect the first detection when in environments where it's hard to get access. So pharmacists were invested in prevention, and they continue to do it, and they're also recently called on for medical prescription for certain medication. So we'll have the opportunity to talk about that. Franck DEVULDER, on the evolution for doctors, what are the big shifts for medical doctors? Before we get more in depth, thank you, Jean-Philippe. We know them. We know that today access to healthcare has become a societal issue. Health has become the second concern for our citizens, and there's many shifts that we know, many mutations, transformation that we know. I'm going to call on 4 of them. 4 epidemiological, which means this medicine that is immediate, that is urgent, that can transform into chronic pathology medicine. So, and that's going to continue. Demographical mutations. A panel member is going to be among us tomorrow or today. The cliff effect. We haven't replaced the issue of the baby boomers. We haven't replaced the number of doctors that are retiring, and we find ourselves today with difficulties that are increasing and that are not just concerning the job of doctors, but many professions in the medical field are impacted. We know that. Professional mutations that touch all of our society with new generations, our children, my children, everyone. We aspire to a different life, a better balance, and in solitary, it's better to be treated by a doctor that is not completely burnout. And finally, this mystery we mentioned in the first roundtable, this mutation, this digital mutation, the role of AI. It's hard to plan for the future and to see to what extent it's going to impact us. But already today, it's impacted our organization, and I see a positive aspect into that because I think that it's going to give again time to healthcare providers, and so we have to understand these challenges and act on it. They have to allow us to act. We're trying to find leads on that. Emmanuel HARDY, so you represent the nurses in advanced practice, and so what's the impact? It's an evolution. Yes, it's an evolution for professions. We see three important points. First, the statutes that the legislator has given their opinion on May 19th on the throughout the RIS law, and we're still asking, demanding application of these statutes and change medical recommendations. We would like them to focus more on the population, psychiatry, mental health, and to healthcare for children, because the children we have a progression of infant mortality more than in other OECD countries. So finally, rethink the economic model, which is not adapted. We had 700 euros for the first contract change, and so in the last stat, it's 1,500. It's a statistic from the state, so it doesn't match higher education standards. So better accompanying and better compensation. So Olivier, VIRE from Medipath. So we have observed evolution of their professions as well. And how the impact of digital. Of course, we're the center of the diagnosis, because the diagnosis of disease, namely cancer, is going to be done. He's specialist of imagery, also specialist of molecular tests, and now he's accompanied by algorithms from AI, thanks to digital transformation that we will develop, I hope. And Elie ZERBIB, you are the one through which impact mutations, changes can arrive. You have developed digital solutions. How do you see this transformation for the job of doctors? For me, the main shift is going to be towards AI, without being too original here, and on the ability of AI to free up time for doctors, healthcare providers, to better communicate, to be able to focus on tasks that have higher added value and diminish the whole load, the administrative load and diagnosis aspect that can be automated, industrialized by AI. Thank you. Charles, finally, you represent the pharmaceutical industry. So everything is going to be patient-centered, and on the demographic cliff that we're facing, that's not specific to France. It's a world-wide reality, and we have to find solution. And the good news is that it's a really engine of innovation. We can develop medication faster, vaccines. We can accelerate production. We can find solution for health professionals and for patients. And so I think it's a great hope of ability and capacity to help us manage this demographic cliff and the challenges for our healthcare system. Just one word: we have to dare. Earlier, we spoke about Neuralink, Elon Musk. I don't have any Tesla. The same thing has been done 10 years ago in Grenoble with 7 patients. The difference is that where the Americans are able to mobilize billions of euros, we manage with difficulty with some millions. So I think we have to dare, both on the size of the effort and the direction that we're taking with these new technologies, and dare to overcome barriers, hurdles. I think Maya Noel mentioned that, these famous difficult administrative hurdles. We're not going to get out of it and maximize the use of these innovations, of these mutations, if we reason still profession by profession closed off from each other. Thank you. Very well. So I think there are 2 big themes, one on digital, AI, and a theme on the needs of patients, populational needs. We cannot care for people in the same way as we did before. So we're going to dispatch our time in this way. First, we can start with the impacts of digital transformations. So the interest that we have concrete examples and that you can tell us what are the impacts that have on your professions, how it makes them change and transform, And a change, a shift, is a deep change for profession. It can trigger reactions and a certain number of difficulties that will allow us to work on how we accompany those changes. So to start off, we'll go back with you, Olivier, on this profession that has experienced this mutation that is still ongoing on the arrival of new tools. That has to be part of their trade, of their professions, and they have to work to learn differently now. So indeed, now we have high flow scanners that we can have more precise and interpretation through screens. So the digitization eases exchange, expertise, and remote work. But I would like to insist on the fact that it's the first step to the implementation of algorithm in the daily practice. And these algorithms arrive in all sectors now of our specialty. We find them for detection, so for intrauterine cancers, and in the routine work. It's not in the future, it's now. And detection of uterine cancer allow us to select cells of interest among millions of cells. So we improve our use of time, better diagnosis. And so for the process, tumoral process, for any tumor algorithm are going to be able to target the tumoral areas and the specific type with the improvement of the precision. And it's extremely important. An algorithm in terms of quantification for prognostication. So sometimes they ask us to quantify, knowing that at 1% we can have chemo or not. Human is not good to do that. So algorithm, on the other hand, are going to be much more performant than humans. So in all these cases, there's going to be a control by a doctor. He's going, in the end, the final word, the possibility with to carry out his diagnosis, as you said earlier. But now there are two types of AI that arrive on the market and that work very well. It's AI that's predictable. So predictive of the genomic status of the tumor, and we realize now that we are approaching results of the molecular test. The interest also here is we can make a selection. Molecular tests are going to remain the standard, but we can have savings in terms of health costs. So, and then there's predictive medicine on the evolution of the disease and of cancer, namely, which allow us to appreciate the percentage of chances of evolution, favorable, unfavorable, metastasis, or relapse. So it will allow us to target future treatments. And these the professional is augmented or in competition with this technology? I think no, he's more augmented and completed, and the doctor is going to be put up on the value chain to save time and have time for reflection and put him at the rightful place where he brings his added value in the expertise in difficult cases. Elie, on solutions that you put forward, it comes to help doctors. How does it evolve the profession? How does it integrate into practices? To get back to how it was perceived initially, like any upheavals a few years ago with the arrival of AI, and especially in radiology, it was a help, not really necessary at the start, but now we realize that in France, and to go back on what you were saying about the US, we really have a role here in this game, and the big majority of doctors is familiar with AI, whether it's radiologists or other pathologists. I think we have a lot of good companies, whereas generative AI, not just applied to medicine, but it's going to come. As for specific fields of AI, radiology, and that's a point that we should not forget, that we really have in France our role to play here. So how it's applied in practice, it functions similar to in radiology, animal pathology. I think we're going to be able to develop tools that are going to be able to analyze a great quantity of images and medical imagery, and so we're facing a shortage of doctors and an increasing number of patients. So meeting the needs of equality in terms of territory coverage to be helpful here. And also there's a second side of that, second aspect of that, we're going to get there, is the promise of improving to go on preventive medicine and to improve the diagnosis ability of doctors and therapeutical later on. And in your practice, the example that you might have on the way it can change professions, I think in research, I think at all levels of research, production. So in Neuville, we have an imagery, so next to Lyon, Neuville sur an imagery center that is a worldwide center, expertise center. And we have created a sort of ChatGPT for RNA messaging sequences to optimize the platform that we developed for new vaccines. And so we have trained the machine with 12 million sequences on different bacteria and viruses that have allowed us to increase by a 4 or 5 factor the expression of RNA messaging for clinical tests. That allows us to accelerate development and to save 10 years, and to do that just in a few months. So in the execution of production and clinical development, we use a generative AI called Gen AI, which allows us to optimize the redaction process on the basis of clinical test results to go faster on submitting that to authorities. We save 1 year with an objective of a few weeks just by putting a clinical responsible that is augmented in his own work. And so on the daily work, what we offer to health professionals, we have an application called Accelerea, which is available for any health professionals that will allow to help for diagnosis of 250 rare diseases. So that's very important, I think, to accompany health professionals to go faster in this diagnosis of these rare diseases. So it's critical at all stages. So yes, it's a positive evolution, what you're all saying. Pharmacists, maybe going to go with you. How do you see that? As a positive mutation with new tools or stakes? It's a mutation that we have to embrace, whatever it takes. I think we're going to, steer towards the augmented pharmacist. The idea is that AI doesn't replace the pharmacist, or the pharmacist tries to prevent AI from arriving, because these are struggles that we have already battled, that we already lost. But arriving to an augmented pharmacist, thanks to these tools that are already today, we mentioned a lot of examples, whether it's in the industry, hospitals, medical biology, AI is part of our professions, even though for many pharmacists in practice it's hard to appropriate themselves those technologies, to understand well the inner workings in terms of data use, of security for patients. And some are already asking themselves, not on the interest of AI, of the use of AI, but what are the impacts of them? We talked about GRPD. What is the responsibility of the pharmacist? We could integrate those tools. So there's a lot of questioning in terms of trust. Even though everyone is convinced of what it's going to bring to us in our daily life, both to patients and health professionals, but there's still a lot of questioning around regulation, around the use of data, code of ethics for professionals that are in activity. And so there's undeniably a lot of things existing, but we could go really further. And just 2 seconds, I think there's a lot of domains where AI is still lacking by lack of interoperability between our systems, lack of communication. We talked about garage workers, automobile. They can integrate AI in the calculation for dietitians, according to weather, days of work, remote working, that can calculate to the gram the nutrition needed and to make savings. And so we're not able to do that in the medical supply chain to fight against shortages of medication. So there's a lot of domains where we need still. The transformation is ongoing still. So we have to see for the code of ethics. And so for doctors, Franck, how this time that's freed up is going to help in reality. I think it's really an opportunity. One of the complaints of our patients, but any healthcare providers, is time dedicated. I was taking the shuttle from Bellegarde to here, and and I was talking to a nurse student, and we talked about the evolution of professions. It's going to free up time for professionals. That's what is lacking. And there's two aspects in the end in AI. There's technological AI that you mentioned. How can I do animal pathology with all this help, or pharmacy? How can we, for gastroenterologist that I am, how can we call for more software to analyze images, medical imagery? We're going to detect 15–30% more polyps. So this impact is great. And same thing for surgical robotics. I don't think it's going to replace the healthcare providers. It's going to complete them. It's not going to make it easier, I think. Not going to make our jobs easier to save you time. And there's organizational AI. We see it in the evolution of our software, professional software. The time that we save with all the concerns and the human guarantee is going to ensure that in Europe. Same thing. There's the same thing in the US. The human guarantee, the Biden administration has taken the same measures, but I think it's going to help us, and it helps us in our daily life, in our organizations. When we look behind, what was our job 15, 20 years ago? Wow, what a progress we've made, but we're not completely using AI in our daily work. I think it's an opportunity, so a potential that we can maximize. We talk about other aspects, about digital, which is a real topic. The other transformation is the needs of patients. We don't treat a patient today as we did before. As you said, we have chronic diseases that are more and more important. And today there are evolutions in therapeutics, so our professionals have to adjust to that. So Emmanuel, I think it's your topic that is at the foundation of the practice that you represent here. What is the evolution? I think first you have to look at the current situation, and there's a very good study by the Adresse on the evolution of the health situation of the population. We have the whole mapping of increase of addiction, infant obesity, inequality, social and territorial inequalities that are widening. So we have to focus on that. And people renouncing care, I've looked at the main motivations for that are financial, and then waiting time, that is, so people become wary, and apprehension. So I think for that, you're going to have to open new doors into the system to free the patients, coordinated caregivers, so the caregivers can responsibly steer the patient accordingly. And I think to be able to work that, you have to work together in trust. And so the trust, I think, can go through respect. And I've seen that we compare us a lot we call on to deregulate the system with a two-speed medicine, with those who can pay for transportation, those who can go to consultation places, unequal coverage of the territory of healthcare providers. And I think we're going to have to sit around the table and have this discussion to be able to transform in the interest of those who need care, and curative or palliative. So there's new needs. So we don't have any more professionals because of demographic professions are going to have to change, and it's going to have an impact on the relation between the different professions. Yes, and I'm very proud that pedicures can meet directly their patient, and the people for their wounds can meet with the doctor, or and so it's unbreathable for many people. They wait months for an exam. This is something that you've experienced with pharmacists. You talked about new needs, prevention. The pharmacists are changing their profession to be able to meet those needs. So yes, the needs in terms of prevention, we mentioned that it's a major access, and the pharmacists in their pharmacies see 4 million French people of all ages per day. So it's an entry door into the health system and prevention, but it's important indeed to take up these challenges for tomorrow, because this is what we see today. Otherwise, we leave the door open to sectarian abuse, and we have absolutely to be able to avoid that. So people don't find professionals; they turn to other people, and we observe that already. So it's for us professionals in the system and politicians to set up an access to healthcare that is worthy of the name for patients. And I think we're going to have to, another challenge to take up, the home turn. So keeping people at home for home care, where professionals are going to have their role to play, and that's going to happen only if we sit around the table in a coordination. We talk about coordinated practice, exercise. That's paramount to get to see develop in good intelligence these coordinated exercise to meet the needs of tomorrow and of today, or even yesterday, I would say. So, Franck, in the end, this transformations is not putting into question the role of each one, a shift in the organization and the function regarding each other, and maybe an evolution of the different perimeters. I think there's a word that we always talk about that we haven't, is the word territory, and I'll mention that in my conclusion because everything is done on a given territory, geographical context, a job that we never talked about when we talk about mutation, transformation. We talk about pharmacists. And how about the doctor? We don't think that his job is changing. Of course, his job is evolving. The job of a doctor is an expert of your health. The epidemiological transformation, it's about doctors. And I'm glad I said that the medical convention was signed. And we know the role that medical professional trades are playing, have played. It's a starting point. When we put in the medical convention that words that are new in a medical convention, put the word quality, relevance. These are new words in a medical convention. And me personally, as a representative of my professional trade, I'm calling for this. But do we have to deregulate everything? No. I think we have to do it territory by territory. I think all the experimentation that have been done, I ban the word transfer of skills. You can acquire skills everywhere in health, or you don't transfer it. You can acquire them. I can understand that, among others, many trade representatives talk about delegation. Delegation, they can't bear that word. Let's accept the principle of sharing skills, competencies. Let's start from the territory. Where we see what works in territories, in all organizations, let's have things evolve together. But let's not call for deregulating everything. I was reading in the paper for pharmacists, in 72% of municipalities, there's no doctors or pharmacists. I read that 2 days ago. I haven't checked the source. I'm not convinced that we need a pharmacist in every town or a doctor, but we need a medical organization where in every community or gathering of municipalities, I'm not going to say as a doctor, since there's no pharmacist in the town village, I'm going to become a pharmacist myself because I always need the same medication. No, I think it's going to be bad for our practices. Of course, we don't have enough centers, and we don't entrust enough patients. We've been defending that in our professional organization, but it's not a work in delegation when a doctor entrusts to an IPA. It's not delegation in his field of competencies. So for chronic disease, there's a right of therapeutical adaptation, and that can be all tied together. But what I think is dangerous, and the High Health Authority and his president, I'm not sure he's behind me, yes. He has expressed some concerns over the law that you mentioned, but if it's to say we put direct access to anyone, I'm unable to do my job of a nurse or a pharmacist. Let's be very careful about this. It was to replace the word delegation. We can talk about steering, like we can steer because your field of competencies is complicated and you cannot find it elsewhere. Or you can steer a patient, direct a patient to an IPA. Or so steering, you need a professional to steer, to direct. So, and some people don't have the professional in front of them to steer. So, of course, the law has been voted on, but we're waiting for the application decrees. It was voted on May 19th after parliamentary debate. There was a lot of protection given by the Senate, but let's work in the interest of the population. I think it's the good professionals at the right time, at the right place. that's the threefold aspect that we have to look into. And in the field of competencies, I think that with all professionals, health professionals, we have to be able to meet the needs of our citizens, and that's paramount. That means we have a populational needs, shortages of professionals, so we have to find new ways of accompanying patients, and nevertheless, we have to find something harmonious, coordinated, that meets the threefold aspect that you mentioned. So we mentioned freedom, equality, and fraternity. Is it on all the territory? The studies show that no. As a Republican, I call on this. And so you talked about the needs of the population to adapt professions. I'm going to change topic a little bit because I think that in our professions, we possessing a lot of health data, and this health data, it's constrained to certain territories, and we have clinical data. We cannot match data from Strasbourg with data that's in Bordeaux. So the territoriality is key here. And so these health data, we're able to have structured reports that just need to be exploited and used. And so there's a necessity of working on the territory. And when we talk about coordination, through data, you can maybe have this needs for coordination among professionals, and so that anyone can exercise their own skills at their own level. Thanks a lot. You talked about accompanying there's the shift, this transformation, there's two that we mentioned, and now we're going to take the time how we accompany professionals. Some are able to go easily, to go through transformation easily, but you need to accompany professionals, so you shall, as head of a company, human resources, that's what you work on in a daily fashion. How do you do that? So we work a lot on it. There's three things. A first framework, which is training. We have invested a lot in mass training on AI, on our employees, free and time given. That's very important. There's becoming familiar. We're at the start of AI and the beginning of its use. We know that it's going to increase a lot for a lot of professions, and for some, we imagine it, but it hasn't been formalized yet. What we have decided to do is to make available tools, AI tools, in a large scale. We have a tool called Play on big data for all of our employees. There are 25,000 in the world that have access to this tool. A site director can have recommendations of these tools on all the data available on how you can optimize the capacity of his site and meet clients' demands. And these are tools that we create daily. We also have a partnership with Juicy in order for our personnel, our medical specialists have access to all the health data available up to today. So these are tools that our employees can become familiar with, and we have to find today how we increase our efficiency and to have this culture of digital transformation. And also we work on excellence centers. We're very present in France in terms of R&D. We invest 2.5 billion a year, and we have established in Paris an R&D center for AI with 100 people in Paris, which is a worldwide reference center. It's going to be contacted by all the R&D Sanofi employees worldwide if they need expertise and advice on how to use AI in order to go faster on the development of medication. 33 access to familiarization, training, and excellence center. These are and develop usages. So this is a little bit what you were saying, you too, on accompanying professionals that are going to be called on to use these AI solutions. There's a training aspect, even though they're motivated when they come to see you, but there's also creating trust. Of course, there's a sort of evangelization of this new technology and how to use it. We don't use Naviglia like the advice of a peer. So there's necessarily an adaptation phase, an apprenticeship phase to be able to use those new tools for the training with AI part. And the second aspect to be able to train maybe health professionals that are not ready to accept the emergence of new jobs, like so for orthopedists or midwives regarding gynecologists. I think to make people realize that the emergence of these new trades, new jobs, are going to be a major asset for health in France and overall, and for the daily life of health professionals that maybe do not wish those emergencies. For the daily life is going to have, so you have this as initial training? No. Continuous training and lifelong training to create collaboration systems within. So for radiologists, we can decline it in all specialties. So Olivier, for the company to accompany. So digital transformation is complex. I think we have to have a holistic approach. Initial training of doctors that are going to use it, and technical is going to improve workflow. But important points are important here. The quality of networks, transfer networks of imagery. And sometimes we don't have fiber, or we have 4G, but it's hard. And an image, medical image, is 1 or 2 gigabytes, or the cost of scanners, which are out of this world and are not adjusted to development of these practices. And this interoperability between the management systems of these images, and then this acculturation, a general acculturation, but of all doctors and patients, to be able to understand what can be for them and for all. It's not obvious. For doctors, they say, oh, yeah, they don't know what to do with it. So there's that. And then we need strong personalities that transfer messages. When we talk about AI, we hear about, yes, but the risk for my data. We don't talk about the future project. I think it's a miscommunication here. And to finish off, we have to find the means to assess very quickly these AI algorithms to find sustainable funding. And funding is existing. They were steered only to the public sectors. And for public hospitals, a majority of diagnoses from cancer are done in the private sector. So I think there's something to correct here. Franck, on your side, to accompany healthcare professionals on these technological adjustments and the practice and their daily practice. As I said earlier, I think the key word is territory. The second word is, you're not going to be surprised, is company, business. I think deeply to medical entrepreneurship. I think we have to go towards the creation of free practice hospital communities, and we have to look what's happening elsewhere. In less than 1% of American doctors work isolated. Today, we do 10 kilometers. When Switzerland, Germany, a medical practice is 1 doctor, 2 or 3 nurses, IPA, psychologists, and does it mean that the doctor is the all-powerful leader here? As Guy said in the introduction, let's look at foreign models, and the doctor is at the head. I think the doctor has to be at the center, not at the head, because you have bad experience on that. It's not from him, but if that's paramount if we have to ensure quality. But we get to that by accompanying health professionals, and I think we have structures existing. I think about regional health authorities. I think it's a principal role to identify territory by territory. Maybe not for great regions. I come from Reims. I don't know what's happening on the other side of the Vosges. And I think the mutual is true. I don't think we're going to redraw the whole laws on territory, but by department or interregions, we know what's happening. We know where the issues lie. We have to identify a company. The key model that we bear here is the one for specialists, is specialized teams. If this organization can facilitate access to care of the population, or resort to a doctor who's specialist as second resort, or generalists, or the hospital, I think we're going to make a great step. The second point is that let's look at tomorrow. Tomorrow, it means also those who are today in training, those who are going to enter the practice and become our medical professionals. I think we have, I'm not in favor, maybe I'm going to be polemical here. I'm not in favor of the multiplication of university hospital centers. If we multiply them, I think we have to look service by service to have training, treatment, and research all in one. I think if we look at those who work hard, it's hard to do all these jobs. I think we have to make them more academic and to allow those in free practice or in hospitals to have this role. I think we're going to have to ensure this quest of building a company together, and and this regionalization that we talk about in all domains. We nationalized the organization through. I think we have to dare and go towards these themes. So work together on territory. I think it's one of the leads, Emmanuel. I think there's two aspects: training of health professionals, namely. I think about simulation of interviews in the use of AI, because even in university, in the masters, we have peaks of medical accreditation. I think there's things we have to reform if we have to adjust the future needs of society. And the second aspect is those who are in practice, the professionals in practice who have 20, 30 years in practice, and you have to get used to AI and do trainings, and so continuous complementary training. And these are the two key aspects. If we want to develop those new technologies, they're going to change our practices. And about working together, coordination, I think I'm going to agree with Dr. DEVULDER. We're going to have research departments in primary care. That's been done in many countries, and we don't have it. Research is closed off, clustered into hospitals and centered more on the medical aspects. And we have the nurse sciences, which is recognized worldwide, and that can change society deeply in depth, and to explore the environment in the wider sense, environmental knowledge in the broader sense. And so to think wider. And in a team, never alone. And so we see that the needs to work together is an aspiration. If not to have an isolated practice, and to work with other professionals to better coordinate to the benefit of the population, because we have several opinions, and I think we can be more efficient with several opinions. So pharmacists indeed, we need to accompany them in this evolution towards the augmented pharmacist, even though the pharmacist, I think, has always been in advance on technology. He always managed to appropriate those methods and techniques. And the cutting edge, I'll talk about the pharmacist file that was put in place before other tools, before other IT tools. I think for training, and I'll get back to that, I'll say first to reassure health professionals on what AI is going to bring. It's not going to replace them, it's going to augment them. There's this notion of reassuring, but to reassure, you have to guarantee a quality of practices, a quality of care for patients, with reassuring by asserting that through regulations, laws, legislation. It's not going to contribute to reassure them necessarily, but ensure a quality of practices, and indeed train. From the youngest age, but younger generations do it intuitively. They have that in their DNA. We have the need to better anticipate. In France, I think, initial training and lifelong training. And there's other innovation in other countries where, when the evolutions arrive in the practice on the ground, young people, they already have acquired them in initial training. And we have an issue of lifelong training. I think, but that's a real topic. Even though we look to evolve towards more certifications, we have systems that are not easy to access and to understand, and for health professionals with little means available, little funding. And I think that we have to give ourselves the ambition to train and to accompany health professionals, including on territories and decentralize training and better adjust to the groundwork needs and to those of the professionals. Nobody or has little mention about the funding, because it's a global thing here, to accompany those transformations. We talked about economic model in the previous roundtable. Do we have the means? Does the system favor this transformation, or is it a break or a hurdle? The funding, we all read the report of the Senate on the financialization. Let's not mix that with funding. It's a truth, absolute truth, that funding is absolutely necessary. And I don't believe that the funding can come from only from the state or taxpayers and social contribution. We need funding from all. But let's look into the report from the Senate that's proposing that we can all support. Let's be vigilant so that the perverse effect of the financialization do not touch on our freedom and our independence in our health system. I think we have 5 minutes left. So just a word on what seems the most important to accompany those transformations and the expectation that you have, all of you. It's a unique opportunity, this transformation. We're fortunate to have it, to have AI and the acceleration that accompanies it. And my second message, let's dare. I think we have to dare to overcome the struggles, the petty struggles, and the boundaries that we all set within our organization. I think it's not just the administration, and to work together. And also, let's dare in the scale of what we wish to do. I talk about funding. I think investment. I think we have to dare and to be on scales, bigger scales, because to have an impact, we can have a great impact of this innovation. In one word? In one word, it's complicated. The priority task is ethics, is code of ethics on the use of data and setting up these tools to guarantee to the patient the safety of their care. Maybe a word on the environment that we haven't mentioned up until today, but it will be later. I think that we have to be aware of consumption of energy that this whole technology is bringing, that we cannot set aside. I think there are means, and we have to take it into account for our generations, future generation and children. Emmanuel? Thank you. I was thinking about the professions and what new professions I would like to see in the healthcare system to accompany the needs of the population. Who's better placed than the patient? I would like the creation of a profession of expert patient, like in Canada. We have an example, a recent example, on a PhD on psychiatry, where a patient who had a disease, he was part of the jury to assess the work and that could transform the healthcare system. Olivier? The first point is to accelerate the possibility of assessment of the techniques of AI. The second point is data. We're the profession that's the most digitized of all medical professions. We have huge loads of data that we have to use yet, but it's inconceivable that we set aside of the big government reflection on digital use. And we've been set aside on this global government reflection around data use. And that's going to be similar to what you just said. We have to continue to dare in France because we have the possibility to make great things, to do great things on the AI. And on the second part, to welcome change rather than trying to be always against it, to accompany professionals for the good of the patient. The little difficulty that AI, by freeing time, is just to optimize in a capitalistic way. And so to free up time, to improve care, and increase time given to the patient, and not just in a focus on optimizing the resources. And Franck, finally, we're in France, and we know that this problem touches everyone. We lack 30 million caregivers, healthcare providers in the world. We have 330 million of debt, and we can't do anything. I think the contrary. I don't think who copied. And let's dare to reinvent the healthcare of tomorrow. We have a short-term vision. We have to do with young people, and we have people here present too, maybe only. around the table. But I think this one is younger than the other. Let's dare. Let's look at what's happening abroad. I'm not saying we should do. I'm very interested in the Danish model. I'm not saying it should be copy and paste, but let's dare invent things. I think the Danish model has two virtues, in my own view. Maybe it's incomplete. First is territory, but I've been repeating that already. The second is they had, like us 25 years ago, a system where the center was the hospital, public-private was the hospital. They inverted the whole thing. Let's put this, the general doctor at the center and his whole ecosystem with the pharmacist and all the professionals around him. Every of our citizens, when he enters the system, where does he go first? What door he knocks first? The private practice doctor. Thanks a lot. Thank you for these exchanges around those two great transformations, digital and the needs of patients, and with the, as keyword, audacity, cooperation, trust, and developments of new usages. Thanks a lot.